is Jenny Lauren Dowden for Conduit News, and today we're joined with Dr. Reagan Baber. He is an anesthesiologist at Washington Regional Medical Center, but today he is speaking on his own behalf and not representing the hospital. And we're going to talk about the vaccine mandate. Thank you so much for being here.
Thank you for having me.
Let's talk about what the pandemic has looked like for you, specifically as a doctor and working and really on the front line. What has it been like for you?
Yeah, it's been very eye-opening and life-changing, really. But started back, March, April last year. Started getting reports of scary things happening. I think at the time it was probably in Italy. Starting to come over to the U.S., but we saw some scary things in Italy. So we started wondering what that was going to mean for us, what it was going to look like here. Then started getting some cases here, and didn't know what that was going to really look like. Everybody was kind of unsure about the unknown and how that was going to affect us, and everybody's a little scared and setting up their own little decontamination units in their houses and and everything else just to clean off when they got home. But then it progressed, and hospitals got busier. We started shutting things down, restricting cases just so we can have space open in the hospital, and not overrun it with other services. And then we kind of had our wave and went through it, and came through it okay. But just started noticing things that didn't quite line up. Hearing about cases, a lot of people having cases that weren't nearly as severe as what we've been hearing about. Hearing about the fear being spread about it that seemed unreasonable. It started to seem unreasonable. What didn't seem reasonable at first, and people started not coming to the hospital for treatments of different things. And so then that's when mask mandates started coming about and lockdowns and those kind of things. And I was wondering why we were telling people to wear a mask for a virus. I wear a mask at work every day. I had for years, but it was never for to prevent the spread of a virus. So I was wondering why we were doing that and have people trusting in that. It felt like it was giving people a false sense of security. And then people that were bringing up some of these concerns, they were starting to be silenced and shamed and shunned and threatened, and they just didn't add up with what I knew about how we've treated things before. I mean, we've discussed, science is about debate and, about discussing ideas and asking a question, why are we doing this? And questioning the things we think we know, but those were being silenced. And that's when I started really trying to ask questions and learn and study what was going on, and started becoming a little more skeptical about the way we were doing things. And then just as we progress on, reports of early treatment with different medications started coming out, and it sounds like good news. Hey, we got something that looks like it's working in a nursing home here. We had a nursing home, I think it was in Texas, where they were giving them all early treatment, and I think it was maybe 90% of them recovered and did fine, when in other places 50-60% of nursing home patients were doing very poorly. It's like, that's good news. So he's out in the public telling his story, and he's getting shunned. It's like, why? This should be good news. Why are we shunning this? And so then that just keeps happening as we progress. And then we get into the release of the vaccine, and the promoting of that, and eventually the mandating of that, and the lack of discussion of concerns. And so the people are isolated and discriminated against, segregated. Those that are vaccinated, those that are unvaccinated. And it's just kind of further ingrained in me the how wrong a lot of this is.
Well, while you were at Washington Regional, and then they discussed the vaccine mandate, what was your first reaction?
Well, first reaction was I wasn't surprised. I mean, I figured they would mandate it. They mandated the other vaccines before. The flu vaccine is mandated. So wasn't surprised that happened. I was nervous or concerned about what that might mean for those that chose to file for an exemption for it. But at the time, I wasn't surprised. I figured that would probably happen. But it's been since they've accepted some of the religious exemptions and accommodations I've seen that has made me have some issues.
What does that look like?
So in my opinion, I filed for a religious exemption and they accepted it, but with some accommodations, and I think everybody's accommodations are probably similar. I don't know that for a fact, but in my opinion, they're pretty onerous, and it's you have to wear N95 mask and eyewear at all times. In fact, the accommodations in the state are clear that this means you're not even to remove them to eat or drink when you're in the building.
How do you do that?
Well, you leave the building.
But then can you leave the building if you were?
You can, but there are some situations that make that not possible, and so it makes it hard. And then on top of that, submit a negative test weekly, regardless of symptoms or anything, and that's only required of unvaccinated people. So in my mind, it's inconsistent with what we know about who is susceptible for transmitting the disease, and it just feels like it's punitive more than based on science.
Right. And that's what we're hearing, that it feels like a lot of this is more just about punishing those who choose not to comply rather than actually following the science. What would you say to those who are not complying, or they are in similar situations, maybe where their religious exemption is not being accepted? What would you say to those people?
I'd say you have every right to be standing up for what you're standing up for. And if you're being discriminated against on that basis, then that's wrong. It's illegal, and they should stand strong and stand up for what they believe in.
It almost seems like at times, between how we're dividing up in sectors, vaccinated versus unvaccinated.
Yeah.
And like you said, that creates almost a climate of division and discrimination. And as if, getting this vaccine is a moral necessity.
Right.
Go and do it for the greater good. But then if you choose not to, for whatever reason,
right,
it's almost as if it's being allowed, it's okay to treat the unvaccinated as second-class citizens.
Correct. Yeah. And especially in this case, I think that's wrong, and it's incorrect for what we know based on science. We've been told, and we've seen through study and by admission of CDC and other regulatory bodies, those that are vaccinated can still contract the disease, and they can still spread the disease. And there's several studies that showing viral loads within vaccinated individuals that have been infected, have a regular infection. Viral loads are just as high, and in some cases were much higher than those in the unvaccinated individuals. So it just supports the idea that they're able to spread the disease. So there's no reason to separate vaccinated and unvaccinated based on the risk of transmission of the disease. And that's what we're doing. We're debating, these people are unclean, these people are safe, let's stay away from these people, when the people that you're associating with have just as much a risk of spreading it to you as these people over here.
Natural immunity and immunity, that has always been, widely known and accepted.
Sure.
But it seems that now it's almost being, pushed back. No, there is no such thing as natural immunity.
Right.
Don't trust your immunity system. You need to have the vaccine in order to, keep yourself and others safe. What do you say about that?
I say COVID is real. COVID is a concern for some people. There's definitely some groups that are at high risk of disease from COVID, and vaccine probably makes sense in some of those people. But I think there is a legitimate risk-benefit analysis that can take place. People that can assess their own risk and decide whether they need to have it. And one of those groups are previously infected people. we know based on observation and on large retrospective studies that those with prior infection of COVID have a long, robust immunity to future disease. And so to ignore the fact that natural immunity provides protection and that you don't need to trust that and therefore you have to get the vaccine is just not being honest with what we know with the data. And what we know with the vaccine, it's an mRNA vaccines that we have are teaching your body to create spike protein, which then your immune system creates antibodies to that spike protein. So then you're potentially protected against future disease based on the attack of that spike protein. But if you're previously infected and your body is exposed to the whole virus, there's a whole host of antigens and proteins that are on that virus body that your body is exposed to. So you're going to make antibodies to several different pathogens or antigens. And so why wouldn't that provide you with at least significant protection, if not better protection than what the vaccines give you?
We hear a lot in the news and from others, follow the science.
Sure.
Follow the science.
Right.
And what I'm hearing you say is we're not following the science. We're not paying attention to what our studies are showing us. Why do you think that is? Are there contributing factors that you think are, where we're maybe not doing that?
Well, I think there is. I mean, I think what we're doing right now is we're following a scientist. We're not following science. What we've said before, science is about debate, exchanging ideas, testing what we think we know, and comparing it with people around the world. But that's not what we're doing. We're following a scientist, or a group of scientists, and just listening to what they say. And I think that's come from an aura of fear. Everybody's been driven into this hole of fear and just kind of paralyzed to know what to do, and have somebody that's giving you ideas on what to do. And so you listen to that, and that kind of gives you some security that this is what we need to do. And that security, even if it's a false sense of security, gives you some comfort. And so then if there's people that are questioning that, you're questioning people's comfort. And so you start coming out of the realm of science and kind of into the realm of dogma and just listening to what somebody's telling you to do. There's times of emergency where you kind of have to just take the best knowledge you have at the moment. So I think that's probably where we were in the beginning of this, but now we're a year and a half into it, and there's ideas all over the place on what can be done to improve things, what can be taken to improve things, and some of those are accepted and some of those are rejected, and the rejected ones are just never to be talked about again. And that doesn't mean they've been disproven; it just means they've been shunned and ridiculed. And so that's been very harmful, I believe.
Have you spoken to your colleagues or anyone else that you've worked with that are in a similar situation as you are regarding the mandate, the religious exemption? What are you hearing from others?
Yeah, there's some others that I work with. Hospitals kind of spread into pods. Not a technical term, but you have groups of employees that kind of work together more often than others. I think there was 6% of the staff that filed for exemption, and I probably know maybe 10 of those people, and so I haven't talked to very many of them, but yeah, there are others, and they're all very similar stories of just being feeling lost, confused of why this is happening, kind of feeling alone, and feel like they don't have support, and they need a voice.
Our state legislature comes back on Wednesday. A lot of us want them to consider COVID-19 legislation to protect these employees, to perhaps put restrictions around these large corporations that are implementing the vaccinations, as well as just consider a health patient's Bill of Rights.
Yeah.
What would you specifically say to our legislators if you were sitting down with one of them right now? What would you want them to know about your position and where other Arkansans are regarding this overreach?
I'd want to know those that have chosen not to get the vaccine, and those that, and even physicians that choose to treat things in a different way than what's prescribed by, the ivory tower. These are not uneducated, uninformed people. These are people that, care for their community, care for their patients, care about their families and their friends. They're educated people, they're physicians, they're nurses, they're pharmacists, they're pastors. They're people that, care about those that are around them. And there's no reason to segregate them. There's no reason to treat them as unclean, treat them as different. They should be treated the same as everybody else.
Come October 1st, that's
Mhm.
when Washington Regional has issued their mandate. What happens with you?
Well, if I don't agree to the accommodations, then I suppose they will ask me to no longer provide my services there. So we'll see what happens.
And what are your thoughts on that?
I definitely don't want that to happen. I've been there since 2015. I have good friends and colleagues there, and I was actually the director of the anesthesia department there. Feel like I made good connections with people in that role, met people in all the different departments, and I've loved working there. And so I definitely didn't have any desire to to cause a ruckus or to go against any of their wishes. But at the same time, I feel like freedoms are being trampled, and I have to speak for myself and for others that are like me, that don't feel like they have a voice, to stand up for what's right.
Well, thank you so much. Thank you
Yeah.
so much for coming in here and talking to us. And we hope to have you back in the studio
Yeah,
soon.
thank you so much. Good to be here.